The proposals being put forth today are a result of much hard work on the part of the budget staff in both houses. From leadership to members' input, from advocacy from community stakeholders, feedback from administrative departments, and the expert analytical perspectives of the LAO. As the chair of Sub 1, I am proud that we have collectively engaged in putting forward this proposal to ensure that our safety net programs are protected at a time when they are needed most. Budget decisions are never easy, even during years of prosperity. And that is why collaborative work is so important during times of fiscal stress. I know that as we continue to work with our administration to reach an agreement that will provide the short-term, immediate relief that our families need, that we will also bear in mind the long-term resiliency that we will also need as a state in order to achieve a health recovery. As in medicine, the health of the whole body depends on the strength of each organ. The last few weeks have been difficult for many reasons, and we have all had to react and adapt to new processes, especially during committee hearings. But I'd like to make sure that we also acknowledge the hard advocacy efforts of our most important stakeholder, the public. And that is why, as we continue to work in reaching a budget agreement with our administration, I would like to take this time to thank and remind us about the young mother who called in asking for us to protect the program that pays for her child's hearing aid, for the IHSS workers and families of the aged, blind, and disabled who depend on those support services every day, to the child welfare advocates who remind us how important continuity of services is for foster youth and non-minor dependent adults and their families, to the intellectual and independent disability community members who have worked so hard before and during COVID to ensure that Californians with IDD and their families are protected, to the immigrant and health policy advocates who continue to push for health care for all, and the many older adult agencies and nonprofits who are working relentlessly to protect the dignity and health of all seniors. And as our behavioral health champions remind us so clearly, nothing about us without us. To all those members of the public and the many more I didn't list, please know that we took your comments to heart, and we listened when you called in, often waiting for hours at a time on hold. Please know that I will do everything I can to advocate for protection of these programs within my subcommittee. Today's discussion on the trailer bill package is an important step towards meeting our state obligations. Thank you.